This is the Fix Your Sciatica podcast.
How was your sleep? How would you feel about having an extra hour of sleep? What if your sciatica pain is keeping you at night? What do we do? Now, these questions highlight the importance of sleep on our overall health, but better yet, our pain tolerance. Sleep in itself is a way for our brains to clear out any sort of extra waste that may have been accumulated during our waking hours, but it's also a way for our bodies to heal from the stresses and injuries that we incur on a daily basis. And today I'm going to share with you how pain and sleep are interrelated, show some causes of how pain can influence sleep and vice versa, and then from there provide you a simple set of strategies to improve your night so you can at least get some shut-eye and feel a little bit better when it comes to your sciatica pain. This episode actually holds true to my heart because as of this recording, I'm the proud father of a 4-month baby girl, and it is the most joyful time in my life, but I totally understand the sleep challenges that come along with a baby. And it's also really easy to drink multiple cups of caffeine for that caffeine rush only to be left feeling jittery and more tired, which is why I've been using Magic Mind. The Magic Mind Focus Shot is a great way for me to get a boost of focus as the day progresses without leaving me feeling over-caffeinated. And I usually have my first coffee at around 5:30 a.m. when I wake up. I actually have a large glass of water before I have my coffee. And then I'll actually start my workout, whether it be some weights or for some cardio. From there, I'm going to have my breakfast and get started with my workday. And if I do need an extra boost, I will take the Magic Mind at around 11 a.m. before lunch. And that way I can have some energy and get back to focusing on my projects without needing to take a nap. But in some cases, I might take a nap if I have to. But what's great about Magic Mind is that it lets me push on without having to close my eyes. And so as the day progresses and evening comes along, I have actually adopted a new wind down routine, which includes both bath time for my daughter, story time, and then as we are all getting ready for bed, I will actually take my Magic Mind sleep elixir, which is about 30 minutes before bed to help my nervous system get more relaxed to get ready for sleep. I do about a 5 to 10 minute meditation and then it's lights out. And the reason why I have chosen Magic Mind over other tools is that they have natural ingredients and they do work. I noticed that, especially I know that I don't do very well with extra melatonin. It usually leaves me having extremely vivid dreams and also leaves me waking up super sweaty. Opting out of the melatonin-free tools has been very, very helpful, and it's one of the many reasons why I love the Magic Mind Sleep Elixir. Now, Magic Mind is actually having a 45% off sale on their 24-hour pack, which includes both the Focus and Sleep Shot or Sleep Elixir. And you can find them at my affiliate, which I'm going to put in the show notes, which is going to be www.magicmind.com, FYSPJAN, to claim your discount. So let's take a deeper dive into sleep. Now, it's recommended that most adults sleep 7 to 10 hours a night, and it allows, again, our brains to clear out some of the metabolites that accumulate when we are awake, and it also allows our bodies to repair any damaged tissues. And when we are injured, we're most likely dealing with some sort of damaged tissue in the first place. Pain intensity and sleep disturbances influence each other in a vicious cycle. This means that having high pain actually reduces the amount of sleep or reduces the amount of your ability to sleep. And if you have poor sleep, your pain may actually be more intense. I thought that this was just related to chronic pain or when you're having pain that lasts more than 12 weeks, but this is also related to the acute stages of pain or when you're having pain that has occurred within the past 6 weeks. Now, before we continue talking about sleep, it is important to talk a little bit more about the stages of pain and what happens at each stage so we can identify what needs to be done at each specific time. Now, the acute stage of pain, and this is actually going to be from the initial onset of injury to about 6 weeks. This is likely that there's going to be some sort of tissue injury or, in most cases, tissue inflammation or irritation. And regardless of the level of injury, there is going to be some sort of inflammation because we need to facilitate healing. There's going to be a lot of blood flow to the injured area, and this inflammation will actually cause a little bit of swelling in a localized area, which can actually increase the initial pain because of that swelling. During the acute stage, we're actually looking at protection of the joint or protection of the body part pain-free movement, and sometimes inflammation reduction. But remember, we do need to have some inflammation in order for us to heal from our injuries. And so we then transition into the subacute stage, which lasts between 6 to 12 weeks. This is a time of typical tissue remodeling. There are cells that are being laid on the damaged tissue or nerve, and healing is actually taking place. The inflammation actually starts to go down, and the pain should start to subside as that tissue gets a little bit stronger. Then we transition to the chronic stage at about 9 to 12 weeks. We have tissue maturation, where the area of injury has healed and gotten stronger than before. Inflammation is a little bit lower and pain should be at a minimum. Now, if you've been continuously feeling pain throughout the 12 weeks without any sort of change, then you're most likely doing something that is consistently irritating it. And one of those factors is lack of sleep. Now, how does pain actually influence sleep? And the question is, when was the last time you were able to sleep when caffeinated, or when your pain was so bad you couldn't even get comfortable? Was it last night? Was it the past 2 weeks? The pain itself can actually be intense enough for you to stay awake, leaving you feeling more tired than before, weaker, and in even more pain. So how does a lack of sleep actually increase your pain? And it has to do with what hormones are being produced to keep you awake and alert when sleep deprived. And the main hormone is cortisol. This hormone is linked to our sympathetic nervous system, or the fight or flight system. This is the exact opposite of the parasympathetic system, which is designed for the rest and digest. Cortisol is released when you are stressed as a way to send energy to your brain and muscles so that you can either fight your way out of trouble or run away from it. And it often shuts down when you're resting, as there is no trouble for the most part. However, the pain we feel is actually a signal from the brain that there is some sort of danger or irritant. And as a result, your body, specifically your kidneys, release cortisol, or your adrenals release cortisol to keep you awake. When you are staying awake and all your senses are heightened, oftentimes your pain sensitivity is going to be elevated as well. And what ends up happening is that you have increased pain, and when you get less sleep, which heightens your pain, which limits your sleep, it becomes a vicious cycle. But the good news is that there are ways to break this cycle, and we have 3 main strategies for improving your sleep when dealing with sciatica pain. The first is a pre-sleep stretching routine. When it comes to pain and stretching, we actually need to focus on the muscles and joints groups that actually improve your pain. So we have to address the things that are truly tight, not feeling tight, but are actually tight. Now, before we talk about the specific stretches, let's talk about the dosage of these stretches, or how long do you hold them for. This is one of the very few times at night that I actually recommend static stretching, because with static stretching, you're holding a stretch for 30 seconds to 2 minutes, and it's going to actually help that muscle relax, and in essence relaxes you. The way that it works is that when you take a muscle and apply a stretch or tension, you're going to activate the Golgi tendon organs, aka the GTOs, which is going to tell that muscle to relax. And so when it comes to identifying what stretches to do when you are getting ready for bed, there's a little bit of an algorithm, and the key is what is going to make you feel better. So if your pain is actually better sitting versus standing, then you might actually tolerate more rounding of the back or flexion-based motions. So you can do a simple forward fold in standing, forward fold in sitting, like touching your toes, or when laying on your back, you can pull your knees to your chest, or you can even do a hamstring stretch as well, and you can hold these positions for about 2 minutes. If your pain is better in standing versus sitting, then a simple backwards bend can be helpful. So to get you ready for bed, a simple cobra stretch where you're just resting on your elbows, on your stomach, taking deep breaths, is actually a great way to relax the muscles and back to help you get to sleep. Now, when it comes to side stretches, like leaning to the side or stretching to the side, it's usually just one side that is going to help you feel better than doing both. So if you find that doing a side bend is in fact helpful, just work on the side that actually brings you the most relief. You don't need to do the other side, and I promise you that you will not be uneven. And in fact, you're probably uneven now, and doing just one side is going to level you out a little bit. Now, the same condition goes in regards to a spinal twist. Sometimes people like to have their shoulders move in one direction and then their hips move in one direction, and you're going to feel great in just one direction, but maybe not so great in the other. So hang in just one direction and you do not have to switch sides. I'm actually a huge fan of the frog stretch as well. That's when you get on all fours, you spread your knees out and sit your hips back onto your heels. Usually this is done dynamically where you're kind of bouncing in and out of the stretch to get your hips. But as I said before, when you're doing something before bed, you want everything to relax. So you might actually benefit from more of a static stretch, again, holding it for 2 minutes. And the link for the frog stretch specifically will be found in the show notes. This goes on in regards to nighttime stretches, and you can do as many as you like, but the reality is that you need to focus on the ones that actually make you feel the best. And you'll be surprised that you might only need 2 to 3 stretches and no more than that.
This episode is brought to you by the Patient Advocate Program. Are you tired of not having support between your rehab sessions? Introducing the Patient Advocate Program, and we're focused on your recovery, and we're offering you 24/7 access to a doctorate of physical therapy. Stop waiting in line to be seen and stop spending hours doing long exercise programs. Imagine being able to get all of your care delivered straight to your phone. Best of all, it's affordable. We believe everyone deserves top-notch relief without breaking the bank. So why wait? Take control of your health today and visit ptpatientadvocate.com and book your free call with our experts.
The second strategy is actually a focus on improving your sleep hygiene or pre-bed routine. Now, I know this may sound so cliche, but it really does work. I know for myself when I don't follow these specific tactics that my sleep does get off, and I know that because I do track my sleep on a daily basis. The first step is going to be limiting my caffeine intake to no later than 2 p.m. So if I drink it any later, that caffeine is still going to be in my system as the night comes on, and it's going to prevent me from getting a nice deep sleep. I also try to stay properly hydrated throughout the day so I'm not spending the whole night waking up to go to the bathroom. A lot of people talk about alcohol and that actually how that affects sleep. I know for me, I do enjoy the occasional half glass. When I say half glass, it's usually about 2 ounces. I notice that my sleep doesn't get affected if I have that before 3 o'clock. So if I'm going to have wine with my meal, it's usually going to be lunchtime, or knowing if I'm going to have a glass of wine at dinner, just knowing that my sleep will be slightly altered. But usually I do not drink more than 2 ounces or a half glass of wine a night. And I find that it allows me to enjoy the wine that I picked out, and then also allows me to heighten the experience when it comes to eating as well. So the next step is actually having a consistent sleep schedule. And so the daily fluctuations in bedtime can actually throw off your circadian rhythm, aka your internal clock, and affect your ability to fall asleep and stay asleep. So you don't have to be super strict, but if you do notice that you're doom scrolling social media into the wee hours of the evening, then it might actually be a good time for you to start cutting that time down, which actually brings me up to my next point, which is going to be trying to reduce your screen time within the last 2 hours before bed. And I know it can be very hard to not watch TV or scroll through social media or go through your different apps on your phone, but the blue light from these devices can actually alter your brain's circadian rhythm, leading to change in your sleep patterns. And if you can't help but watch a screen, adding a blue light blocker to your current lenses, which is a very common feature at optometrists, or adding a blue light blocking lens such as goggles can be helpful. So you'll often see glasses with an orange hue to it, and that will block out the blue light. And another option is actually trying to lower the brightness level on your screens, so then that way you're not disturbing that circadian rhythm. The Sleep Foundation actually recommends lowering your bedroom temperature between 65 to 68 degrees Fahrenheit. The lower temperature actually allows you to get into a deeper sleep. And I personally love the weight of my blankets, and especially when it comes to cozying up at night. We live in North California, so it's been getting a little bit on the chillier side, and we just make sure that our temperature thermostats don't get any higher than 68. It saves on gas, but also, again, the cooler temperature allows both me, my wife, and my daughter a nice deep sleep. And another thing is you can do is take a shower before bed. I like taking my showers at night unless I'm working out in the morning. Taking a shower at night is a great way to get the sweat and dirt off your body, but it also does a couple of different things. It actually allows you to feel relaxed. I know I feel extremely relaxed after a shower, and also helps reduce your core body temperature, which then helps you sleep even better. Another tactic is actually getting the room as dark as possible. So if you can block out any ambient light, it's actually going to allow you to ensure that you're sleeping in a dark environment. I also like to have my white noise machine to provide some consistent ambient noise, and it's soothing. It allows me to get into a deeper sleep. And one of the newest activities that I just started to do is mindful breathing. You can call it meditation if you'd like. I like to just focus on breathing itself. And I'll set myself about a 5 to 10 minute timer, and I'll focus specifically on the technique of box breathing. This is going to be done on my back with my knees bent and feet flat, or whatever position is going to be the most comfortable for you. And then I'm going to be focusing on the following breath cycle. Breathe in for 4 seconds. I hold for 4 seconds. I breathe out for 4 seconds, and then hold for 4 seconds. And then I'm going to repeat that sequence the whole time. I usually make it to about 8 minutes before I actually fall asleep. So it actually is very relaxing. So we've covered some pre-bed stretches and the optimal sleep habits before bed. The last thing that we need to talk about is actually the sleep position. If you look on the message boards like Reddit or on Meta or Facebook, you're going to come across a lot of comments talking about different positions, about people living and dying for certain positions. And the reality is that there's no position that is going to be off limits as long as it allows you to fall asleep and be comfortable. You may need to have a bolster or a couple pillows by you to keep you in that specific position, but you might also need to have a little bit of freedom of motion so that you don't wake up stiff. So it's going to be entirely dependent on you and what you tolerate most. If you like laying on your side, you can absolutely lay on your side. If you like laying on your back with your feet elevated, lift those feet, get into that position. If you lay twisted, then lay twisted. And this is actually where your body's going to tell you what you need, and you have permission to assume that position. So for me, I love sleeping on my right side. But interesting enough, the moment that I actually switch sides with my wife, I actually enjoy sleeping on my left side. So it's going to be very dependent on the person as well as the sleep surface that you're going to be on. And so in regards to sleep surface, we're not just talking about optimal sleep position, but also specifically laying down with the right mechanics, laying down and getting out of bed with the right mechanics as well. And so the first step is actually going to be sitting on your bed. You want to sit so that the hips go back and down like you're squatting. If your chest is too high, you run the risk of pinching your low back. If your knees cave in, you run the risk of pinching at your glutes and your hips. And so I actually have a video on how to rise and get down to your bed, and I'm actually going to be putting in that show notes today as well. Now, when you do lay down, the key is to log roll, meaning that your shoulders and your hips will be moving together as a unit. So if you are twisting your whole body and not at your low back. And so I'm also going to be putting a video on how to log roll in the show notes as well, so you know exactly what I'm talking about. Your sleeping surface is also going to be crucial to your comfort as well. Now, did you know that you should be rotating your mattress every 4 to 6 months? And I mean that by rotating it 180 degrees, so foot to head or head to foot. And the typical mattress lasts about 10 years. So if you're sleeping on a really old mattress, it may be time to find another one if possible. I'm actually a huge fan of a little bit on the firmer side of mattresses that also have a little bit of a give. My wife and I have actually been sleeping on our Casper mattress since 2017, and we absolutely love it. It has that memory foam-like mattress, but it's also on the firmer side and provides just enough support for my back, my neck, and my shoulders, and my wife loves it as well, and it's something that she enjoyed sleeping on throughout her 9 months of pregnancy, and I cannot recommend them enough, and I'm a huge fan. So I'm actually going to be sharing my Amazon affiliate link in the show notes if you're in the market for another mattress, and I just want to say, I know that it can be daunting and strange to purchase a mattress online, but the great thing is that there are sleep trials, especially with Casper and even through Amazon. So if you don't like the mattress, you can always return it. But this is the one that I often recommend to my patients and my clients. Sleep is extremely important to our health, and I totally understand how the pain and even the anxiety from the pain can alter our sleep, and also having altered sleep can have a huge impact on our pain. And this vicious cycle can stop as long as we implement the strategies that I talked about in this episode, which includes a pre-bed stretching routine, establishing an optimal nighttime routine, and finding the right position to sleep for you. Have a lovely and deep sleep tonight. You absolutely deserve it. Thank you so much for tuning in. We hope you got some help from today's podcast. And for more info, check us out at ifixyoursciatica.com. Have a fantastic and pain-free day. No patient-therapist relationship is formed by listening to this podcast. We are not providing medical advice, and all information should be confirmed by a medical provider.